Good afternoon and welcome to 802 Scoop, live from 185 North Main Street here in Barrie. It's a beautiful afternoon, and a beautiful afternoon to be joined by these fine ladies here in the studio with me, and here to talk about a very important upcoming training that the Central Vermont Prevention Coalition, along with other local partners, the Fire Department and CBMC, Turning Point Center, they're going to have this training here local, and we're going to not just talk about that, but other things in the community as far as the number of overdoses recently, things that are just happening in our community, and how you can be involved in maybe how you can learn a little bit more yourself about it. So with that, let's welcome Eva Zaret, Moriah Haggett, and Marissa Patrick from CBMC. And good afternoon, ladies. How are you?
Good. Thanks for having us.
Yeah. I'm happy to have you all. Who wants to kick off and kind of say who you are and a little bit about this training?
Yeah, so we are from Central Vermont Prevention Coalition, which is a group of local community organizations and providers and people with lived experience that get together monthly to talk about what's going on in the community and how we can improve substance use prevention and treatment. Recently, there was an uptick in overdoses in our community, and we recognize this both in the emergency room and also the fire department posted on Facebook about an increase in overdoses. So with that, we put together a group of us to figure out how we could address this and help. And so with that, we decided to organize an overdose response training. And that's going to be happening this Thursday at 5:30 at the Barrie Social Club. Vermont Cares is going to be joining us to do that, in addition to the fire department and us. So it should be good. And
so when we talk about the training, or is it just the training of the use of Narcan, or is it a little broader than that?
Yeah, it'll be a little broader than that. So we'll kind of talk to people about current conditions and the drug supply, and the fire department will kind of open it up and talk about what they've been experiencing. And then Vermont Cares will do a really good job of helping the community understand if they do think that there's an overdose or they're concerned about somebody that they see, how they could assess and monitor that person. And Narcan is just a piece of that, right? Mm-hmm. Like if you decide that somebody really is in a situation where they need Narcan, they'll teach you how to use it, but also teach you how to look at somebody, see if they're breathing, talk about rescue breathing, and then the kinds of things that you might want to do for someone after if you have used Narcan to take care of them.
Mm-hmm. Nice. And Moriah, you will be there as a member of or as an employee or of the Turning Point Center, or?
Yes.
Is that?
Yeah, I will be there to If anybody has questions about what Turning Point offers as far as supports in groups, coaching, things like that. Yeah.
And you are based out of the ER most of the time, or the ED they call it now?
I am.
Yeah.
Yeah. I'm the supervisor of the recovery coaching in the emergency department program for Turning Point.
Which is something really new or newer. That's not something that was around certainly even 10 years ago, where you could go to the ED and get help immediately, where it was really focused on what can we do for you? These are the services that are offered, and how can we get you there? Or do you even want, the help and actually fostering that connection with others?
Yeah. And we meet, when we do meet with people up there, we meet people, where they're at with their substance use. I mean, if it's that they want to get into treatment, then we can talk about that. If they aren't ready to stop using for whatever reason, then we can talk about harm reduction and, other ways to be able to stay safe. Hopefully get them set up with one-on-one coaching so that they've got somebody to talk to. It's really the most important piece of that is the connection piece, because even if they're not ready to stop using at that point, it could be another time down the road, and they know that they've got somebody that they can talk
to. And it could be even
to.
hours later when
Yep.
it's kind of like sunk in a little bit, and
Yep.
they've kind of come around to, what did I just do to myself? And
Yep.
maybe I should call that person back, or I have that business card now, and I can make those connections.
Yeah.
And so, and you never do know when that's going to happen for someone.
Right.
And so, Marissa, as a nurse practitioner, do you see it a lot as well?
Yep, so I work in primary care, and in addition to all the other chronic illnesses, I also do a lot of substance use treatment in primary care, and I serve as a spoke provider. So with the hub and spoke model, we're a spoke prescribing treatment for substance use treatment. And I think what we've gotten better about is linking all of the services of care. So I think at CVMC in the emergency department, we really worked on improving treatment of substance use treatment and then linking to care outside of the emergency department. I think many years ago, someone would end up in the ED, they'd be treated in that moment, but then kind of sent out the door and not really given options for treatment afterwards. So having peer recovery coaches in the ED is huge, because that helps link those people with emergency care and then treatment afterwards, or whatever their treatment looks like or what they want to pursue.
Right.
And it's true. I mean, someone could ask, a couple hours or a couple of days, or even sometimes we see people a few months later that we're seen in the emergency department that all of a sudden walk into their primary care office or walk into Turning Point and say, hey, I'm ready now.
Yeah.
And Eva, when I first met you, I think it was a little over 3 years ago, maybe pushing even 4 years ago now, that you had just kind of just started. You had all just gotten the funding and just kind of started kicking things off, and you weren't sure where you would be at this point. And
Yeah.
it seems like, you've come a long way. And unfortunately, you've come a long way because it's an obvious needed resource in the community. The coalition is obvious that it's very needed.
Right.
Yeah.
Yeah, that's right. We had just gotten a big grant, and then COVID happened. And so we were really uncertain, like, how all of these initiatives were going to play out. And we're really, really fortunate in Central Vermont to have this coalition. It's pretty remarkable. Not every community has something like this, where sectors are talking to one another, fire department and recovery coaches working together in the emergency department, and other communities have come to us to ask how they could kind of get something like this going. And it's really important, because if we're all operating in isolation, we don't know what everybody else is doing, and we're not using our resources effectively, or we might be all doing the same thing, and we could be talking with one another. And so, I think this group has now been around for a decade, which is pretty amazing, but really able to operationalize things in the past 5 years or so. So we've been trying to expand some of our work and do some more work in prevention, because we've been pretty harm reduction, treatment recovery focused. But yeah, I love this work.
Well, and I think when I think about it in the community, and I even think about myself, my own personal situations, or and people that I'm close with, I think that when you all kind of came aboard, that's when it gave opportunity to know that you're not alone, and whether you're a parent that's dealing with it and you think you don't want your friends to know, or you're somebody that's actually actively using and you think this is the only core group of people you have, are the people that maybe they need help just as much as you do, and that changing your people, places, things, it's not always easy to do because it can be a lonely place. And I think that you have all kind of shown that it doesn't have to be so lonely, that you are there for people. There is help and resources and people just like you who are battling the same thing that you're battling. And we didn't really talk about that stuff. I don't remember hearing a whole lot about it, and I certainly didn't talk a lot about it. I lived totally silent, with the covers over my head, dealing with it all by myself for a long, long time. And it feels good, and it seems crazy to say that, but it seems good to feel like there are other people going through this with me, and I don't have to be by myself.
Oh yeah, no, I don't think anybody can get through. First of all, I don't think that there's any family probably in the country that's untouched by addiction, substance use in some way. It's just, and so to think that you're alone, you're not. We've all been impacted in some way. And the second thing is, you can't get through something like this on your own. You just can't. You need a community around you. And that's one of the most important points I wish that we could just say every day. And you've done such a good job, Raylene, of using your platform to bring this conversation out into the open, is to say there's everybody that you would meet. If you're thinking about that, you're concerned about your use, or you are questioning, or you really are struggling, on the other side of asking for help is people like us who really care, who are there to support you and not judge you at all, have seen all kinds of situations, all different kinds of substances, all different kinds of people, and really are here working hard every day to make this a good place to seek help if and when you're ready.
Yeah.
Right. And I think in the community it's tough because you get into situations where people, there's assumptions no matter where you go about everything. And so just because somebody is a drug addict and they're actively using, that doesn't make them a criminal. That doesn't mean that they're stealing from people, harming people. That doesn't mean there are criminals in every walk of life, whether you're suffering with substance use disorder or not, or a mental health disorder. That doesn't make you a criminal. It just makes you a person that's hurting and needs help, just like somebody else that has a medical condition. And so I think that it's tough because the stigma is there. Yes, are there people suffering with substance use disorder that are committing crimes to support their habit? Absolutely. We won't deny that at all. It's one of the means of doing that. But they're not the only people committing crimes. And they are not, you can't pin that on just that disorder and saying, that's what's wrecking our community. It is wrecking our community in a huge way, but not for that reason. It's because it's literally killing people. It's ruining our community because of what it's taking away from us. And with all of you, we have a chance to change that.
Yeah.
Yeah.
Yeah. Just because somebody is using drugs or alcohol, right? Like we don't talk about alcohol enough,
Yeah.
I think.
Right, I agree.
That's the elephant in the room.
Yeah.
Right.
It kills more people, but it's socially acceptable, right? And we see, Marissa sees younger and younger people having really advanced.
Liver cirrhosis is now like happening more often in people's 40s than later in life.
Wow.
So just because somebody's using and doesn't make them a bad person, it doesn't mean that they are committing crimes. Unfortunately, these things do happen sometimes, and but always we're looking for how can we help this person who's really suffering and has probably, there's often a lot of trauma behind, deep down that has been
sometimes
unaddressed.
even just stresses of work and daily life and
Oh, yeah.
I mean, I've met some people that were in very very well educated jobs, that very high up, presidents, CEOs, this, that, and the other, of in their positions, and they were abusing alcohol or they started using drugs, and but it was a way, no matter what, it was always a way to cope. It was a way to figure out how to cope with something that they didn't know how to cope with otherwise. And so
it
you're,
does
just,
not
you're trying to give tools.
Yeah.
It does not discriminate. It doesn't
No.
matter
Yeah.
how much money you make,
No.
and in fact, Vermonters who earn the most amount of money drink the most, is what we know from surveys. And so,
Well, they probably socialize more, right?
yeah,
They have
right,
The money
there's
to
all-
go out and socialize and kick back a little more.
right, there's all kinds of things that we might not think if we're making these assumptions, right? Yeah.
Yeah.
Yeah. Well, and little by little, hopefully, we can break all that silence and talk about the stigmas and change people's minds and the way they think about that. As we were talking about just before we started, it's hard to explain, and it's hard to talk to people who really already have this preconceived notion of what Narcan is, and the fact that, why are you using it? Why are you saving their life? Why are you, those conversations are tough to have, but we all have them every day.
Yeah.
And hopefully this training that you're going to do can help with some of that.
Yeah, Narcan is really important that we should all have access to, because you never know when you could be anywhere and you find someone that needs Narcan and you could help save a life. And Narcan is also very safe. There is no harm to using Narcan. I think sometimes there is a misconception that people are afraid that it could be harmful, but it is a safe medication.
Right, because it can be used even if you're not 100% positive and you use it, it's okay.
Yeah.
Yes.
If I used it on Marissa right now,
I would
nothing
be
would
fine.
happen. I have a picture of my 3-year-old, actually when she was younger, playing with like a whole bunch of Narcan on my bed before a training that, I was going to bring it with me, and she like got it out of the box and she's holding it, and I have no concerns that that's going to be harmful to her. It's pretty funny, actually.
Yeah. This might be a good spot to talk about where you can get Narcan, because I think everyone should
Yes,
be able to
absolutely.
access it. So all CVMC practices now have harm reduction kits, which include Narcan. We also have xylazine and fentanyl test strips in harm reduction kits. They're all provided by the state, the harm reduction kits, because there's a lot of xylazine in the drug supply right now, in addition to fentanyl, and that's something to be aware of. Also, 75% of overdoses last year included coke or cocaine and crack. So something that people need to be aware of is fentanyl is now being found in cocaine and crack, which is very scary, because a lot of people may not want to use opiates, and then they're using it, not realizing it.
Right, and that actually changes the addiction as well, right? Because then how you detox from both are very different.
Yeah.
Yes, yeah. So in withdrawal can be, so if someone is given Narcan, we have provided trainings to the EMTs on how to give compassionate care in those situations. So in addition to providing Narcan, also giving medications to help people with the symptoms of withdrawal.
Yeah. For example, you could feel, you might feel nauseous. You might feel nauseous afterwards. And so there's medications that EMS can give you to help you not feel so sick. Yeah. So if you go into your primary care office at CVMC, you can get one of these kits. We now have them just available. Women's health, if you're there for an appointment, urgent care, even pediatrics. Yeah, so you can go and just get Narcan. You can also get Narcan at a pharmacy. And then a lot of the local treatment providers have Narcan. Vermont Cares, which is right here in Barrie, has free Narcan, and Turning Point.
Yeah, we have Narcan.
And I know, I believe that you spoke of Joe Aldsworth. I believe that Joe has been really good about distributing it through the fire department as well.
Yeah.
I know that the Associated General Contractors of Vermont in Montpelier, Richard Robbie and some people down there have been making sure that job sites have it, because it is it's very common in that field that people are using, and even on lunch, and so that to make sure that each job site has Narcan available, and I believe that that's what Joe has done in different in businesses to make sure that people on Main Street have it, and then others as well.
This is so important. Like Joe and is it Dick Wabi?
Yes.
Can you introduce me to him? I really need to meet him.
He's a great guy. He's a great guy. He really is.
This is amazing. Construction is the #1 field of overdoses. And so it's really important to have that kind of buy-in within that area from people like him who are willing, because I can go in and people can listen to my spiel and whatnot, but I don't work in construction. But if it comes from within, there's so much more buy-in.
And they do trainings. They do
that's
suicide
fantastic.
prevention training, and they do overdose awareness. They do a lot of trainings through what they do down there in Montpelier for the construction industry.
It's amazing. And it's also a workforce, it's supporting the workforce, right?
Yes.
And we really need all the help we can get these days. So
For sure.
Definitely.
yeah.
For sure. So at the training, what can people expect?
Yeah, so Vermont Cares will be hosting the training. Well, they'll be sort of doing the training, and Rachel is the trainer, and she's so fantastic. And we're doing these in collaboration with the fire department, because we really want to be supporting the fire department. They have a lot of calls related to overdoses, but a lot of the times that somebody might see someone and just not be sure and call 911, but it's not quite an emergency, which you should always call. It's always okay. But this is going to help empower the community to feel like they know how to respond and make the right decision about whether or not to call 911. So the training will kind of go over those things. The fire department will talk a little bit about what they're seeing day to day. And you might see some acting and some role playing, which could be really fun. And we will have pizza. There will be free pizza, which is
If you say free food, then everybody's in, right?
you have to have free
And
food
pizza.
at a training.
And pizza.
Yeah. Maybe
Yes.
people can comment and let me know where I should get it from.
Yeah, that would be good.
Great idea.
I have a really good idea for you to get, actually. They have the best pizza, I think, ever is Harrington's.
This is going to be the controversy.
I really
It's
do.
not going to be about what we're talking about. It's
It's
going to
gonna
be
be
the pizza.
pizza.
Yeah, I think it's super. They have really, really good pizza.
Okay,
at
good to know.
Harrington's. Yeah. Well, the guy that owns it he used to cook for Mr. Z's for years and
Oh,
years
okay,
and years.
yeah.
So, and he
makes
brought it
sense.
all up there with him, and it's the same. It's amazing. Yeah, it's become a once a week habit. But yeah, so
So people can use to learn Narcan,
Yes.
and we'll have Narcan available, so people could leave with Narcan and leave with little rescue barriers for rescue breathing barriers, because rescue breaths is an important part of the overdose response process now, especially with xylazine, because it's so sedating. So making sure that people are getting oxygen is really important, right, while you're waiting for services to come. And then people like Marissa and Moriah will be there to talk to folks. Like if they go through this training, but they're experiencing something, whether it's themselves or a family member or a friend, will be there. You two will be there to talk, and you can talk about what next steps might look like and what it takes to navigate, you know, the treatment system.
So before we talk about next steps, let's talk about the overdose, the use of Narcan, whether you're just somebody passing by or you're somebody that is with the person, you're using together, you're friends, you're in a group of people, whatever. I think it's really important that people know that if you, one, call for help, that you or the person you're trying to help they're not in trouble. You know, the police may come with the fire department, almost always they do, or the EMTs. There's always, because let's face it, there could be a situation where they are needed. You never know. But calling for help isn't going to get you in trouble. Using the Narcan isn't going to get you in trouble. Another thing that I've heard is that if you use Narcan on somebody that doesn't need it, you know, they could sue you, or so people being afraid, or lately it's been, yes, and even people that I've seen people complain, you know, I was sleeping on the lawn at the library and somebody called 911. Instead of being angry at that, be grateful is what I hope that people know. I mean, be grateful that somebody cared enough to call and say, hey, I think this person is overdosing. Yes, did it disturb your nap? But what if something worse were happening? And you have to be accepting of the fact that somebody cared enough to get you help.
Yeah.
And people have to know that that's not going to get you. You're not going to get into trouble for asking for that help, even if you go to the ED.
No, you definitely won't get in trouble.
No, and I know that some people, and I'm sure that you can help with this, Moriah. Some people know that there are occasions that screeners are called from Washington County Mental Health to evaluate a situation as well. That doesn't mean you're in trouble either. It just means that it's another connection for further service.
Right. Yeah, that's one of the things that really bothers me with some of the overdoses lately is that people have been scared to come in. So they've, refused transport to come up. Well, if you've overdosed and you've been Narcaned, please come get checked out. Just make sure that everything is still okay.
Right, because that doesn't mean, just because you've been Narcan doesn't mean you're not still overdosing, because isn't there a window where you can still experience overdose symptoms or even overdose?
Yes, absolutely. So it's definitely better to come in. And I can say that I think one of the other reasons why people get scared is they feel that they're going to be stigmatized there and, judged there. And they're not. I work with amazing providers and nurses and care management. Everybody really does truly care up there. So you're not going to be judged by coming in and getting checked out. And you can meet with one of us if you want to. There's always a coach on. Excuse me, sorry. There's always a coach on, and if they're not there in person, then we can get paged in. And even if it's just to say hi, and you're not ready to go.
You give a card and you make the connection.
Absolutely.
Yeah.
Yeah. And all of us coaches are in recovery. I mean, you can't be a coach unless you are. So.
You've been there.
We've been
Like,
there.
Yeah.
Yeah.
Which for me, that's a really special connection, even as a mom. For me to be able to talk to somebody that is in recovery, it's hope with a capital H in bold capital H. It's just, there's hope right there, is that I know that there can be a good end in sight, right? And so just having that connection and knowing that when I arrive at the hospital, hopefully, somebody calls me and says, your son is here, this is what has happened, and I'm able to go, and being able to have that connection myself with somebody and knowing that that person is there for them, and that can be an encouraged environment and a new fostered relationship for them is huge.
Yeah. And then you can continue to follow up with the recovery coach after that visit.
Yeah.
Right, because you're not there just for, that's the main goal is the people that are in, are trying to be in recovery, but you're there to help all the way through with the families as
With the
well.
families
there are
too.
groups and
Yeah, so if a mom or a dad or whoever got a call that their child or whatever family member came in, and that family member doesn't want to have, connections with the coaches, the family can, because the family needs support too, because
right. And so,
It's hard.
And just to be clear, it's not you that calls the mom or dad or family
No.
member. You don't let anybody know.
No.
It is confidential. That is not what we're saying. If the person that is there, just like any other patient in the hospital, wants that support from a family member or somebody outside, then the call can be made.
Yes. And actually, if we were to say somebody came in and their family was there with them, right? When we talk to a person, when we go to it and we approach them, if they're not comfortable speaking to us with family there, then we do ask that whoever that is leave so that we can talk to that person. But that connection still goes to a family member if they want it. They could call themselves down to Turning Point and say, hey, I've got a son, a daughter, a sister, a brother, a mom, a dad, whoever, a friend who's struggling with substance use and I need help. And we give the supports to them too. We do one-on-one coaching with people as well. So you can do, a private conversation with somebody, and we're not counselors, we're not therapists, we're all people with lived experience. Sometimes we can understand a little bit better where people are coming from, and definitely no judgment, because we've all done things that we're really not proud of. So
Right. Yeah. Upcoming weekend, big weekend here in the city. We have the Heritage Festival. There's going to be a lot of people around, and all walks of life, all different kinds of things happening. What are things that you all believe that the community should and could be aware of that maybe they're not even, like things to just keep watch of or notice? Or we talked about if you have your children with you, and what do you do if you find needles? What are things that we should be talking to our kids about prior to, not just this big event where everybody's going to be downtown kind of thing, but even every day? What are things that you feel like we need to really start recognizing as a whole, as a community, so that we can all learn together?
Well, I think a couple of things. I think from my perspective, so we all have really different perspectives, which is cool, right? So, from a public health perspective and a prevention lens, we should be having conversations early and often with our kids about substance use and setting expectations in your household, and boundaries, talking at an age appropriate level, but pretty young, because by the time high school comes, you should be having those conversations way earlier, and set expectations. Okay, my expectation is that you're not going to drink alcohol, and you might be faced with, a decision about this. Someone might offer it to you. Why don't we practice at home how you might say no in a way that like feels cool, right? Like, and doesn't make you feel like lame, right? You can have those conversations at home. You can visit our website, cvprevention.org, and you can learn some of these sort of parenting and caregiving skills that you can implement with your kids. Making sure your children always know that they could contact you, like if they were at a party or in a situation and they felt uncomfortable, they should have an escape route, whether that's like a code word that they text you or a way that they can call you and let you know that they need you to come pick them up. That's also really important, so that they know that you have their back and you're supporting them. So those are kinds of like the early and often conversations about prevention. And then I also always think that we should be teaching our children to be compassionate towards community members who might be struggling or suffering or dealing with mental illness or dealing with any kind of chronic illness. And so the way that you respond and act towards other people, or if that's how your kids are also they're going to model that, right? Or you're modeling it, they're going to replicate it. So being compassionate when you see people who are in a different situation than you, it's really important.
Yeah, I agree. We all have very different roles, but we're all moms, and and we're all part of this community. So I think it's really important that we're a part of this community. We show that we're caring and we want to help each other so that we can make Barry better.
If you do see a needle, you don't need to pick it up. You can let the fire department know. Like Joe Aldsworth is so good about like needle disposal. You can let the health department know. There's different ways to deal with needles. If you were in a position to dispose of them, you can do so. Actually, at the training on Thursday, we're going to have little mini sharps containers that can hold like 10 sharps in each one. If you don't have anything available to you, you can put it in like a old laundry detergent container with the lid. It's like something that it won't puncture, and you can dispose of them that way. It's actually really unlikely that you're going to contract something from a needle poke from a needle that you just find, but it's always better to be super safe when you're handling sharps. So
Absolutely. And not long ago, I had done a post, and because I started seeing these things pop up all over the place, and it was really bothering me that they're these little rubber like trinket boxes, and then I know from experience at home that what those trinket boxes are being used to store now. And at one point, they weren't necessarily used for that. People say, oh, those are nothing. They're for dabs, or they're, just this or that. And numerous times since then, you've seen police reports or the press releases where these little rubber trinket boxes are out there, and they're using them to store crack or coke or fentanyl or sometimes all together or whatever. And I just think it's really important that when we think about these upcoming events, that we not always just focus on what we know, like what we know that needles, that's what that is. We should teach our kids. But I think we should teach our kids not to pick up anything. No matter what it is that, it might be this cute little rubber thing that is kind of cool, looks like a super ball a little bit. They've got flashy colors, sometimes animals or something all over them. They're cool looking, right? And if you're a kid and you pick it up and you put it in your pocket and think, that's really neat, I'm going to save that for later. I think that we should just be, and maybe it seems hyper-focused or overreactive, but I really think it's important that we teach our kids, you don't pick things up and put them in your pocket, and you always ask first, or and it's unfortunate, but I kind of feel like that's where we're at with things, because we just never know.
It's probably better to be cautious.
Yeah.
And yeah, I mean, just the ground is dirty anyway.
Right?
I know. Like the amount of rocks that I have in my washing machine from washing my kids' clothes is just like, yeah, kids do that, right? But yeah, I mean, it's just even like the gasoline and stuff that's like on the street, like you don't want to touch all that stuff.
Yeah, you just don't. You don't pick it up and put it in your pocket. And that's what I mean. It doesn't have to be about, you just should be teaching them that anyway, for any purpose. We don't want to say, don't pick up a needle. It's not all just about that. Yes, we don't want them touching those, but there are so many other things. So you just, instead of creating this stigma, I guess, with it, you just teach them, because it's gross, no matter what's on the ground, you just don't pick anything up, right? We don't have to make it a this is why kind of thing.
Yeah.
Create another stigma, right?
Right.
By saying don't do that. So, yeah. What time is the training? And I know it's at the social club.
Yeah.
Do you know what the address is over there?
Oh gosh.
I'll find it.
I can look it up. So it's at the Barry Social Club, which if you haven't been there, it's amazing. It's an incredibly beautiful space. Nick and Kat have done an incredible job with this location, and we're really fortunate to be able to host this training there. And the training begins at 5:30, so come a little early and you can chat with us and you can get some pizza. Maybe come at like 5:15, get a seat, check out the social club because it's awesome. And then the training will run 5:30 to 7. And last time, we're going to start to hold these more regularly so that we're not holding them always in response to something happening, but just try to have maybe one a quarter or something like that, so that we just always have them ongoing. So we'd love feedback from people. But last time we did a series like this, we actually had people come multiple times. Like they came to the one in Barry and then or in Montpelier, and then vice versa, and they came multiple times. And Vermont Cares hired somebody after one of the trainings. They hired their Barry SSP coordinator. And so we always make incredible connections at them and meet all kinds of people. And so I'm really looking forward to them.
And so the first one is this Thursday. And then, but you do have another one coming up as well.
Yep, August 18th in Montpelier at the Montpelier Library. Same time, 5:30. Yeah.
And do you go outside of this area at all ever to do?
Good question.
Yeah, we've been brainstorming.
Yeah, it's been different. Barry and Montpelier get a lot of the attention because they're like the big cities here.
Right.
In air quotes. But a lot of the more rural outlying towns and villages also need support. Like I live in Marshfield technically, but like Plainfield. And so we talked to the fire department there, and I think we're going to try to get overdose prevention training for like the Plainfield, Marshfield, kind of East Montpelier area. I'd love to get one up in like Woodbury, Calais, Hardwick, like that region. Because just because you live in a rural area doesn't mean that you deserve any less access to information or resources. But it's easy to be forgotten when you live, far out there, and I do, and so I feel this, right?
Do you ever see that you all might be doing this in schools?
Schools do have Narcan available, and school nurses are trained in how to administer Narcan. There have been trainings in schools before. It's obviously a little more delicate because you're talking with children, often under 18, and of course, we want parents to be comfortable with the information their children are receiving. But I think it's an excellent idea to be training our young people in overdose response.
Absolutely.
Yeah.
High school, college alike, freshmen. They're probably the kids that are most apt to be experimenting or partying, and they're going to be with each other in a group, and so knowing what to do. And
Yeah.
and I mean, I go back to when I was a kid. We had MAD, we had DARE, we had all of these different things that don't really seem to exist anymore. We did, assemblies. The week leading up to senior week and the end of the year, there was a smashed up car from a DUI crash, maybe a death on the front lawn of the school. And we talked about that and did, seminars and calling people for a ride and different things like that. And I don't know that that's really being done enough anymore.
Some of these things we unfortunately know are like not that, like we used to do a lot of scare tactics with kids, and what we found through like evaluating those programs is that they're not always as effective as they might seem like they should be. But think, for example, like if you're speeding and your speed flashes up and you're like, oh, I'm speeding, you might slow down for a second, and then a second later you're back at the speed that you were going at before, right? So these these kinds of messages aren't always that effective over the long term. But there's been a little bit of a shift in the way that we approach kind of, drug and alcohol education and prevention in schools. Unfortunately, funding is always an issue for prevention. And there needs to be more funding for prevention. We had just received a large federal grant to do a lot of really amazing prevention work in schools over the next 5 years that was proposed to be eliminated in the recent federal budget. So we were supposed to have it for 5 years, and probably we're not going to have it anymore. So it's really unfortunate to see prevention often is the thing that kind of gets cut out. But then we see the effects of that 20 years later when people are really struggling and could have really used that kind of information when they were younger, and skill building. Yeah.
Because we had just started with Twinfield, and I had gone in with Rosemary as well a few times, and then I went in by myself and worked with the health class there for there was the sophomore class, and we did go over the basics of like Narcan and what overdose looks like and what you should do and that kind of stuff. So the kids are interested and they're curious. They do want to know, and they have great questions. So it's definitely, they want to know. So
Yeah, I don't know. I'm always at the place where I feel like the more honest we are, the better.
Yeah.
And not necessarily scare tactic, but like this is what can truly happen to you. This is what can truly happen to a friend of yours. And so you should even be having conversations amongst each other and making a plan. I mean, we make fire drill plans with our kids, but we don't make plan of if you're in this situation, what are you going to do? Are you going to call and use a code word, a secret code word or whatever? Or we plan for so many things in life. I just feel like, but we don't plan for things like this that truly are life-threatening. They are life-altering, life-threatening.
Yeah.
And I don't know. Man, if I had the money to make it so that it could happen, I would.
If there's a really wealthy donor listening right now, we really can do good things with your money.
Yeah, well, exactly. I mean, it's true though. I mean, if I just feel like silence is what got us here.
Yeah, it's
to the point that we're at, where we're so deep and thick into this now that, and it's because of silence.
Yeah.
Really.
And,
And so, how are we going to stop that part of it?
It's really we're disappointed. There are a couple of weeks where I was just really like, having a hard time with the thought of losing this funding, but now we have to get creative, and this is what Vermont's really good at, is sort of looking inward and saying, okay, we don't have the resources of a big city, so how are we still going to make sure that our young people get the support that they need? And that's just a piece of the puzzle. Like, we know that about a third of high school students report that they're living with a caregiver who's struggling with drugs or alcohol. That's a lot of kids who are going home to a chaotic, potentially traumatic home life. Not to mention there's, maybe a genetic component, right? Because, they're at an increased risk themselves. And so making sure that we can provide support to adults is also prevention for kids. And so we can't just do one thing, right? It has to be a lot of different interventions and strategies that are all kind of working synergistically, like supporting one another. There's not one thing that's going to solve this.
Yeah. We recently had a training on positive childhood experiences too, and how the impact of positive childhood experiences is just as important, if not more important, than adverse childhood experiences. So how can we come together as a community to increase positive childhood experiences to prevent substance use and other things, and just chronic illnesses down the road?
Yeah, because it's not just about saying no, right? First of all, we know that like this abstinence, it's not that effective. But what we should really be asking our kids is, what kind of life do you want to live, right? What kind of life is worth protecting from some of these outside forces that you're going to encounter? What are you passionate about? What do you like doing? How do you spend time with your friends, right? And helping kids build something that they identify with and they value and they want to protect.
They don't need to escape something.
Right.
Yeah.
And then we need to, I think that we also, when we're talking with our kids, teaching our kids, that we need to let them know that they have friends, and they may know people that are going through things that are much different than they are, that maybe they do have a parent that is struggling with substance use, or maybe they're food insecure, or there's all of these things that that you don't want them to dwell on them or look for them, but you want them to be aware of them, so that maybe they even know how to get help themselves and be able to say to a mom, a dad, a teacher, or somebody, I think so and so is got hurt yesterday, or that they they're sad today because of this or that they understand that it's okay for them to want to get help for somebody else just as much as it is for themselves.
Yeah, absolutely. Yeah. That's a really great point.
It's tough for everyone involved, really. It is. It's hard no matter what. Across the line.
Yeah.
And I hope more and more people start coming out to these trainings and wanting to learn more. And I hope we can do more of this, that we can have a full-on assault, as far as a campaign on with podcasts and interviews and shows and information and distribution of any and all of that.
Yeah. We'll be back every week, Raylene. Don't worry.
And I would have you. I mean, I really would. It was, I think that it's important, and even people that are in recovery, people that are struggling, to do these interviews and to put a human face to what is happening. We had Amy Sherman is tuned in, and she is somebody that I've known for probably 10, 12 years now. I met her at her job, and she's always very open with me. We somehow made this bond or connection, and she was always very open with me about her struggles, and I'm incredibly proud of her. She's on the upside, and she's doing great, but she came in here and told her story, and it was tough for her to do it. It was super tough for her to do it. It was very emotional, but the upside and what she gained from that was huge, because the support, the people that chimed in and reached out to her after, and showed her the pride, and it made all the difference in the world to her.
Yeah.
And to know that she had these connections that she had no idea that she did.
Yeah.
And it made a huge difference for her. And I think that about everyone that has come in and shared their story, no matter what it is. I mean, I remember the first time I interviewed Bob Purvis, you know. It's crazy to think where he was, where he's at, and where he is now as a retired and enjoying his jazz and, you know, just loving life. But that isn't where he always was.
Right.
Yeah.
And for people to know and understand that is huge.
Yeah.
Yeah. So, I mean, I, for one, greatly appreciate everything you do.
Thank you so
And I'm going to
much.
bug Dick to either be in Barrie, that might be too short of a notice, but, or to go to Montpelier with
Yeah, we need to talk to
Yes.
him.
him and his son and everybody else that's involved with what they do
Yeah.
down there, because I think that would be another really good connection, and for even to have them part of what you're doing, to say this is what we do and this is how we do it.
Yeah.
Yeah.
I think it really helps with community buy-in because we work in it, so we can talk about all these things, and I don't even think twice about it anymore. Like, I think if somebody looked at my search history on my computer, they would be like, "What are what are you looking up?"
Right.
Like,
Why are you looking?
Why are you
up that
googling
stuff?
meth or like whatever it is? But when we have people like the fire department or like Dick or whomever, that really helps with the community buy-in, right? You know, so it's super important. And that's a sector that we would like to, you know, the private sector, business, and also the faith-based sort of area. Those are two partnerships that we really want to grow in our coalition. So if you're listening and you'd like to connect with us more, and see how you can get involved and you're in those two areas, we'd love to talk to you.
Yeah, and there's a lot of talk here in Barrie, and I know in other local communities, just because of things that are happening around town, and crime and vandalism, different things like that. But they're talking about bringing neighborhood watch programs back and things. So if you are somebody who is starting one of those neighborhood watch programs in your community, maybe this would be this would be a perfect thing for you to attend and understand a little bit more about, and so that you can maybe talk to your group about it, your neighborhood group about it, and really become neighborhoods that are more aware and understanding, and so that we can, neighborhood by neighborhood, become a community of people that understand and support and see all sides of it.
Yeah, definitely. That's a great point.
Yeah.
So come on out, 5:30 to 7 o'clock, pizza, free food
Pizza.
at a beautiful
Food
space
At a beautiful
Beautiful.
space.
right here on Main Street in Barrie. I didn't look up the address yet, but I will make sure that it gets posted.
Oh yeah, I have it.
And so that everybody knows the address.
105 North Main Street.
105
So just down the
North Main Street
couple
at
blocks
the
from
Barrie
here.
Social Club. Okay. So we'll make sure, and everybody is welcome. It's no matter
Yeah, you don't
who
need to
are.
register. It's totally free. Come. Even if you just want to eat the pizza and you don't want to listen, that's okay. Just come.
Yeah. Well, yeah. But if you're going to eat the pizza, you might as well.
But you
listen
might as
while
well
you're
when
eating,
you're
right?
there.
You might as well listen while you're eating. At least learn a few things.
Yeah.
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 Before we let everyone go, can each of you just tell me if this all stopped tomorrow, there was no more funding, if it all stopped tomorrow, what would be the one thing that you want people to know?
Oh gosh.
We won't stop.
Yeah.
Yeah.
We always find a way. With funding or without funding. I think that's what's pretty remarkable about our group, is that we have continued to meet monthly for 10 years, and a good chunk of that we had no funding, but
Yeah.
we'll find a way.
We never used to have it. So now we're just feel lucky that we do have it. But That's exactly what I was going to say. We won't stop. We'll just figure out how to keep it going. And it's really built, it's because of the relationships that we've built and the trust that we've built and working all together. That's the only way that we can get it done. And we see this in Vermont, like after the floods, when we all come together, and we don't always have the support that a big city might have after a disaster, right? But we just get it done.
Yeah. I think building the relationships are so important. Like for me to be able to see someone and say, hey, I'm going to connect you with Mo. I know Mo. She's amazing. You know, that's so important. Breaking down the silos.
Yeah, for sure.
And we care. Genuinely, wholeheartedly care. Which will make it so that we don't stop. And I don't like being told no, so I'm just going to keep doing it.
Me either. Thank you all so much for coming. And we'll be doing this again soon.
Yeah.
For
Yes,
sure.
thank you.
Thank you, Raylene.
Thank you.
Absolutely.